Good evening, everyone, and welcome to our virtual Family Council meeting. My name is Jamie Rose, and I'm your virtual meeting coordinator. We're going to review our confidentiality statement. Please refrain from using the name of your loved one. Do not name specific facilities. Please use a nursing home or the personal care home to present to the group. If you need specific assistance, please use the chat feature to state which county you are in, and we will get you connected to your assigned ombudsman. And just a reminder, these calls have public access and are designed for family members and friends of residents in long-term care facilities. So our meeting agenda, we're going to get our virtual meeting tips from Jay. Then we're going to turn it over to Cori. She's going to give us some Medicaid tips in nursing homes. And then I'll finish up the meeting with our upcoming meeting topics. So without further ado, I'll turn it over to Mr. Rotz.
Thank you, Jamie, and welcome everyone. You've all been placed on mute upon entry to reduce the background noise. If you would like to speak or have a question, please use the raise hand function. Once you raise your hand, we will know to acknowledge you and unmute your line. The chat feature is at the bottom of your screen. Once you maximize that, you should be able to chat with the chat moderator if you have a question or comment. Closed captioning is available during the call. Please press the CC button at the bottom of the screen to enable the closed captioning. If you do need to step away, you can stop sharing your camera by clicking on the camera icon at the bottom of your screen. You can click on it again to start sharing your camera again. And finally, questions or comments can be directed to me at the State Ombudsman Office. The number is 717-783-8975. or by email at capital-LTC-ombudsman@pa.gov. And at this time, it's my honor to introduce the staff ombudsman from Dauphin County, Cori Hurley. Cori, take it away.
All right, thanks, Jay. Like Jay had mentioned and Jamie had earlier, my presentation today is going to be on Medicaid for nursing home residents. Medicaid is a federal and state funded health insurance. It used to be referred to kind of as a welfare insurance, but it's not just for low income or low asset individuals. It's really important for nursing home residents. It's not necessarily the primary payer. It's as far as Medicare and all of the other insurances, those will still stay as the primary payers, but Medicare does not pay for ongoing long-term care stays. So even though Medicaid is essentially the payer of last resort, there is no other resort for residents in nursing homes who cannot afford to privately pay. And not too many people can, because it's about $10,000 or $12,000 a month if you're privately paying, not to mention the additional costs of prescriptions, hospital stays, specialists, medical equipment, and other miscellaneous expenses that Medicaid actually does cover for nursing home residents. So that's going to be important factors we're going to talk about tonight. One thing to specify, because I know we have a broad spectrum of long-term care residents and families on the line, Medicaid does not pay for personal care home or assisted living stays. That rent is, for the most part in Pennsylvania, unfortunately, a private pay venture. We do have a few homes that have something called an SSI supplement for personal care homes, but those beds are very limited, and the system really fails our residents, unfortunately, who are not nursing home eligible and need government funding to pay for their stay. So that is something that our ombudsman office has been working on for years, but still there's quite a gap there, because the SSI supplement, in order to be eligible for that for personal care homes, you have to make less than $1,280 a month. And if you make less than that and can find an SSI bed, great. But if you don't, yet also don't make enough to afford the up to between $25,000 and $10,000 a month expenses, plus your other expenses, that is going to be really hindering. So there is quite a gap in the long-term care field as far as financial options for our consumers. So something we're continually working on. So unfortunately, I think we do see too many residents who could remain in personal care homes actually go to nursing homes because that's the only funding available once they exhaust their assets or need some level of structured care. So this is why I really think this is important for families and residents of personal care homes to be aware of as well, because it's something to plan for and be aware of your options for the future. So in Pennsylvania, Medicaid is often referred to as medical assistance, or MA for short. So just so you know those terms, often the industry tends to use a lot of acronyms or expect you all to know things that are just secondhand to some of us, but not necessarily if you're not familiar with the field. So we want to give you some insight there. There are state rules to Medicaid, but also federal. So just so you know, in a state, we each have our own guidelines of eligibility. So we're going to go over some of Pennsylvania's guidelines today. If you are in a nursing home and covered by Medicaid, you have 3 options for your Community Health Choices Managed Care Organization. Essentially, there's 3 organizations who operate Medicaid for nursing home residents. Those are UPMC, Pennsylvania Health and Wellness, and either AmeriHealth Caritas or Keystone First, depending on which area of the state you're in. So really, you're not going to notice too much difference from what we're seeing. We just want to let you know that you do have the right to choose between those 3 managed care organizations. You also want to make sure that the nursing home you want to be in is accepting any of those managed care organizations you would choose. So next slide, Judy. Okay, so there are a few aspects you'll need to know about becoming eligible for Medicaid as a nursing home resident. So there is a medical aspect or a functional need that you'd have to be eligible for. So that includes making sure that there's an assessment by the local area agency on aging. There's a certified assessor who will either come out or do this virtually. A lot of things have gone virtual recently in the past couple of years. So if you have insights that maybe the home that your loved one is living in might not have in their records, or if they're coming from the community and going to a nursing home, maybe you want to make sure that you are part of that assessment so that you can give them the full scope of the needs and the situation so that they can make an informed decision on that, determining whether or not the consumer is nursing facility clinically eligible. That's the term they typically use. So there's another aspect, and we're going to focus more on this, financial need. So like I mentioned before, you don't necessarily have to be destitute to be eligible for Medicaid. For anyone who makes less than $2,523 per month in income can have up to $8,000 in assets. So anyone who makes equal to or greater than that has a lower asset threshold at $2,400. So it's a much more complicated calculation than this. Depending on which elder law website or who you talk to, you'll get a little bit different, but this is essentially where we're at with the finances. So that asset does not include your first home and 1 vehicle. If you have a vacation home or something like that, that's going to count. So even if you decide you are going to a nursing home, as long as you can afford to maintain your community home, you have the ability to do that. So we'll talk a little bit more about the short-term options as well here. So assets do include investments, cash value of life insurance policies. If you have a coin collection and that's a reportable asset, then that counts as well. So there's a lot of variables in determining financial eligibility. So, oh yes, thank you, Jamie. Yes, these figures do adjust annually. So that the asset limits typically have been the same, but the income limits do increase every year according to the poverty standards. But as ombudsman, we do not give financial advice. Your business offices at your nursing homes are not going to give you financial advice. Often what we'll recommend is you go to an elder law attorney. That person can help protect any assets that you might have, but also plan for Medicaid eligibility. And it is a good idea to do that sooner than later. If you have a family member in a personal care home, it's something to think about in case for the future they might need Medicaid in a nursing home. And in general, gifting as well, because there is a 5-year look back period for gifting and other aspects of your finances. So you want to make sure that you're protecting yourself, your family, and if you have a spouse, that's something to consider as well, so that they can maintain a quality of life outside of the home if they don't need to go. Other requirements other than the medical and financial include US citizenship or a qualified non-citizenship status, Pennsylvania residency, and a valid social security number. One thing I do want to note can be a challenge because all of us have family members out of state sometimes. So if you have a family member looking to move to Pennsylvania directly into a nursing home, that's going to be a little more complicated than it should have to be. But because you do need Pennsylvania citizenship upon entry, that's something you want to talk to the business office about maneuvering around, and they can hopefully do that for you. Next slide, Jamie. Okay, one of the most important aspects of Medicaid for nursing home residents, especially for the resident, is that they get something called, or I should say, get to keep a personal needs allowance. This comes out of their income. So they keep $45 a month, and otherwise their income is essentially surrendered to the home to pay for their care and contribute to those costs. So this is intended for things non-essential to healthcare. If the resident does not have an income source, they do not get a personal needs allowance because that is sourced from their income. What I would suggest you maybe explore if you encounter that is maybe applying for Social Security disability. If there's an older adult who gets in an accident, they're not Medicare, Social Security retirement eligible yet, there might be some other funding available. So that's something to explore, at least to grab that $45 a month so they have some spending money. So nursing homes are obligated to provide basic toiletries, personal care supplies, soaps, deodorants, razors, toothbrushes, etc. But they're not always, most often I would probably guess, not the brands or scents or quality of the items that the resident might prefer. So the resident or their family members purchase those items, whether it be from the gift shop or ordering them or bringing them in. So that $45 goes pretty quickly. We have been doing a survey actually for the past, I think, 6 years now, trying to get this personal needs allowance increased. And we found that residents are spending this money on such basic items, clothes, shoes, stamps, cards for family members, gifts. Some homes do not cover cable TV or phone service. So that's something that, comes out of that $45. It gets chipped away at pretty quickly. So these are things to think about, especially life insurance premiums. Life insurance premiums are not an allowance that gets counted out of your income. If you have, let's say, a Medicare copay or a private insurance copay, they discount that from the money that you owe the home. But life insurance is not counted toward that. So either you have to have someone else pick up your premium or hope that your $45 a month covers it. So that's a deep consideration for a lot of our residents who've been paying into these policies for decades. So think about those things, and again, an elder law attorney can better guide you on that than we can. So the personal needs allowance has not increased since 2007. Our ombudsman program is trying to get that increased, not only for the immediate future, but also for a cost of living adjustment, so that we don't have to fight every time that inflation goes up. So that's a work in progress for sure, but we want to make sure residents know that they have the right to use these funds however they please. It's not up to anyone else how they use this money. They can have the money in their own bank account, or they can have it in a resident account at the home. And if they have a resident account at the home, they should be provided a quarterly statement of their accounting, as well as really anytime they request. That should be easily accessible for them. So next slide. All right, so since this is a family council, I assume we might have some spouses listening. There's something called a spousal imposition allowance. So this is for a resident who has a spouse who remains in the community in their home, yet would experience financial hardship if the resident has to surrender their income toward their stay. So this really should be something that the business office helps you apply for with the Medicaid application. Ultimately, the resident does have to agree that their money goes to their spouse, but it really won't affect the resident's finances because it doesn't affect the personal needs allowance. It solely means that just less money is going toward the nursing home costs, and Medicaid picks up that. So the county assistance office will assess the spouse's financial situation, their own finances, income, assets, expenses. There's a lot of things, again, that go into this calculation, but they determine what's necessary. The allowance is not guaranteed in any way. We see a lot of spouses who probably could really need it and are not getting this. So it's a pretty tight calculation. The allowance is prioritized as the only community allowance that a resident would be eligible for. So I'm going to go into something in a couple minutes here called home maintenance deduction. Either you get the spousal allowance or the home maintenance deduction. It's really the spousal allowance is the priority there. So it's, again, a complicated calculation. So we won't go into all the numbers of that, but the business office, the county assistance office, as well as your elder law attorney can better guide you on that. Next slide. Okay, so a lot of what I'm going to go over in the next two slides, short-term and long-term stays, will both apply to long-term stays as well. So long-term and short-term stays. So I'll try to clarify that for y'all. One of the biggest challenges we see is that someone comes from the hospital and needs just a short-term stay to recover from an illness or an injury, or even a surgery. And Medicare Part A or any other primary insurance will help to cover that rehab stay. However, we are seeing that residents are not getting really extended coverage of their therapy stays. Even though your insurance might say, hey, we'll cover for 100 days, we're not seeing that actually be approved because you have to remain eligible for the therapy service. And residents are getting cut very early. Sometimes within 10 or 15 days, even though your insurance might say 100 days, it's not always that easy. You have to be making progress and participate. And we still do encourage anyone, if you feel like you still need more therapy, to appeal that. I believe there's 3 steps in that appeal process, and I've seen people win on the 3rd appeal. So don't hesitate to keep pushing and give them as much detail as you can. The Medicare advocacy organization gives you some really great tips on that. And I think they spoke at one of our meetings a year or 2 ago. So you can always look up their speech as well. So we want to make sure that residents know that they've got to have a plan when, even from day one, the nursing home has a discharge plan for you. You also have to have a plan, whether it be for your own discharge, or if you feel like you can't go home quite yet, or you're not safe doing so, and you need to stay for an extended time, the home is going to want to know what payment source is going to cover you. If you can't privately pay, which a lot of people can't, obviously, that's something that you really have to plan for early on. So there's something called a home maintenance deduction. That is intended for residents who, it's intended for residents who have an apartment or a home outside that they have a mortgage on, or rent, or utilities. And there's a lot of things that they can't just say, okay, here's my income. I know I have to contribute toward my stay. They're going to lose their home, or they're going to lose a really important place they have to return to, and make it even harder to discharge. So we really want to make sure that you know this home maintenance deduction is available. So that is only short term though. For the 6 months of your stay, from the day one of admission, even if Medicare paid for the first 2 months, you're still counting those first 2 months for this Medicaid eligibility for the home maintenance deduction. So they will only let you keep $868.10 per month. Even if your mortgage or your rent or your other expenses are higher than that, that's all that you're assigned to keep for your income. So that's another calculation you really have to budget out. Unfortunately, it's not very accommodating. It's another part of our system that I think could use some improvement for sure. And hearing resident stories as to how hard this is, especially with the 6-month limitation. If you go into a nursing home with an amputation, it might take you longer than 6 months to heal up, recover, and get mobile on prosthetics. So unfortunately, it's something I think our system could use some improvement on, but we're working with what we've got for now. There's also something called an excess shelter standard. This is actually something I just learned about in doing research for this presentation, so bear with me that I don't know quite all the details of it, because it's not something that's often spoken of with business offices. So it's essentially a deduction, again, that is not taken out of that income that you otherwise owe the home, when shelter and utility expenses are more than 50% of the monthly gross income after all other deductions. So that may or may not apply to some residents, but it's a potential extra funding source where they can keep some extra money. So something to think about. To be honest, one of our biggest challenges is that residents aren't quite ready to go home after a short 6-month stay. So either they're surrendering their home, or they're trying to scramble to get things done at the very last minute. So it is something to really consider early on and make sure you're planning for. There are in-home services if you feel like, hey, I don't want to be in a nursing home and I want to return home, but I need some support. There are lots of resources available. Medicaid also pays for home and community-based services. They're usually referred to as waiver programs. So there's an aging waiver program for individuals over 60, and then there's several programs for those under 60 years old. There's lots of options out there, so I won't dig too deep into that, but there is something that is especially helpful for nursing home residents. It's called the Nursing Home Transition Program, and it aims to eliminate obstacles that would get in the way of discharging home, whether it be the in-home care, home modifications, a housing search. If you say, okay, I was here longer than 6 months and I lost my place, they'll help you secure housing again, including first month's rent, security deposit, some basic furnishings for an apartment. So this is kind of off topic, but I wanted to make sure we touched on that because it is a huge factor of your consideration for Medicaid funding. So I always recommend, if this is something you're planning on, but you're not sure how long you're going to be in a nursing home or your loved one is, talk to the social worker early on and ask for a nursing home transition referral so that they can get the ball rolling, because things like home modifications or equipment, significant in-home care, that can take a long time to plan. So you want to broach that early on. Next slide. Okay, so long-term stays. These apply to short-term as well, but in general, we consider long-term 6 months or longer. So as I've mentioned repeatedly in the presentation so far, residents are expected to contribute their income toward their stay. So often it's just an automatic expectation, your full income minus that $45 you get to keep, that's what you owe the home. There are, those few short-term exceptions though. So something to think about, as well as the spousal allowance. So for financial arrangements, a lot of homes prefer for residents to have a direct deposit of Social Security or whatever pensions they might receive. They are not obligated to do that. A lot of times business offices will imply that that's necessary, and it's not. As long as you can manage to cut a check, you have the right to continue to manage your own finances and arrange that however you prefer. Often we see that residents don't want to pay the whole bill, but that's often a battle between residents and business offices, but it's still your right to be the one paying the bill rather than direct deposit. Might be easier for the resident or the power of attorney, but that's still up to them. It's definitely easier for the nursing home, but it's not their choice. So unfortunately, we do see a lot of homes applying for representative payee through Social Security. This essentially gives them the financial management power of a resident's entire Social Security check. And on that application to become rep payee, they have to indicate that the resident is not capable of managing their finances. And that's not always the case. So that's something to tread very lightly on for business offices. So if you feel that your loved one or you as a resident do not need a representative payee because you're capable of doing that, you have the right to battle that one, I'd say. So that's something to think about, just to make sure that residents are protected in their rights. So for long-term residents, as well as short-term residents, but often a lot of this falls in the long-term, is that the home is responsible for providing durable medical equipment, bed holds for up to 15 days, obviously the room, the meals. It is a shared room. You're not guaranteed a private room under Medicaid. Medications, caregiving, physician services, any specialty visits as necessary, and really any personal maintenance. And that includes haircuts. A lot of residents have no idea that they have the right to a haircut typically about once a month. That doesn't include special services like dyeing your hair or a perm, but it is something that the resident can unfortunately take out of their personal needs allowance, which doesn't go very far. So if insurance does not cover, even Medicaid, if it does not cover a prescription or a piece of equipment or any other item essential to a resident's well-being, the home is still responsible for making sure the resident gets that. So just because insurance doesn't cover it, if they're on Medicaid and the home is responsible for providing care to that resident, they're responsible for all of those needs. Okay, so homes, as I mentioned before, some residents are reluctant to give up this income, which is understandable. It's very frustrating. You work your whole life to essentially live on $45 for your stay at a nursing home. So often residents refuse, and homes will in turn threaten eviction if a resident doesn't pay their monthly contribution in full. If this does occur, feel free to contact your local ombudsman. We can help work out these conflicts. Often it's kind of a false threat, to be honest. They are really just trying to get you to pay up. But we can help try to negotiate whatever might work for the both of you. It's not a matter of not paying the bill, because you still do owe the bill, but negotiating out of that involuntary discharge. That's really unnecessary. And to be honest, a lot of homes will have difficulty finding another placement for the resident anyway, because no one else wants a resident who's not paying their bill either. So try not to panic too much if that does occur. We can usually help negotiate out of that. So often we find that residents and their families are not given clear or adequate information about the Medicaid system and about income surrender. So it's already difficult enough to move into a rehab center or a nursing home. You're going through enough physical and emotional distress, nonetheless, whatever financial concerns that there might be with that process. So it's hard to recall all of these things, nonetheless, really absorb the drastic effect it might have on a resident and their family. So, your ombudsmen are available for guidance on that. Your business office should be supportive. And even though they might claim to have told you when you first moved into a nursing home, they're dumping a lot of information on you and having you sign a lot of paperwork. So don't hesitate to clarify things and to even put them in your own words, because that can be really a deal breaker when you don't realize, hey, I'm giving up everything I ever tried to build. And now you're stuck with that $45 and you might have to give up your home. So we don't want that for any residents who are looking to remain in the community. So of course, like I said, ombudsmen are your resources here as much as we can be without giving financial or legal advice. We can give you your options and potential consequences and such, and help maneuver your way through the process. But the business office should be also educating and giving you resources and helping you through. But also, like I mentioned before, elder law attorneys can really help be a great advocate on that aspect as well. So in planning and protecting residents and their families. There's one last, next slide. There's one last aspect of Medicaid that I wanted to make you aware of, because it's very rarely discussed. Anyone on Medicaid, whether it be the home and community-based Medicaid or in a nursing home or just regular community Medicaid, they may be subject to a state recovery. So essentially, the state tries to recover the money that they spent on that resident throughout their lifetime. This does not go into effect until the consumer passes away, but it affects their estate, their family, their heirs. So they calculate how much money Medicaid has spent on that consumer in their lifetime. And potentially that could mean that the home that they thought they'd leave behind is taken by the state, or at least expected to be sold, and profits being given to the state. So there are efforts to stop this practice, because it does seem to disadvantage populations who struggle with generational wealth. So Pennsylvania still has this in operation, but there has been discussion, I think specifically by the Justice and Aging organization, in making sure that we're better protecting our seniors and future generations as well. So just something to be aware of, that it's not simply a benefit that doesn't perhaps have consequences after even the consumer passes. So just something to think about. And if you have any questions, I think I'm done with my piece.
Cori, we have an interesting question in the chat. Ken is wondering if MA will cover transportation to doctor and other healthcare providers.
Yes, thank you, Ken. Yes, it does. The Medicaid, whether it be in the nursing home or in the community, if you're on Medicaid, there is transportation covered. Typically in a nursing home, the nursing home will arrange that and do the billing, themselves. The resident doesn't have to deal with that. But if they are residents of the community outside of a nursing home, Medicaid will actually pay for transportation, wheelchair accessible transportation through your local. In our area, it's called CAT Share a Ride, but they're the wheelchair accessible buses that are transporting to and from medical appointments. And usually a private pay fee if you want to go to the grocery store or something along those lines. But yes, thank you, Ken.
Chris is wondering, typically, how long does estate recovery take to settle after a person passes?
I don't know that I have a great answer to that. From what I hear, it's not a quick process. Probate takes months and years sometimes. So I imagine estate recovery is essentially after the whole estate is ready to settle, and then you figure out how much the state might want. You can always appeal and submit a hardship waiver from Medicaid medical assistance estate recovery. So, absolutely explore those alternatives. Your local area agency on aging will have, and it's online as well, will have a booklet that gives you guidance on the whole process. It's quite extensive, actually. So you want to make sure that you have full information before you make any of those decisions.
Ken says that when his father died, it took 8 months after that for the estate recovery process to kick in.
Okay. Thanks, Ken. That's good to know. Oh, and I see Chris added on to his question about estate recovery. I believe it's current market value is what they are basing everything on, not necessarily what your family member might have bought the home for. That's what the estate is currently worth.
Caitlin is saying that she did not know that haircuts are included.
Yes. I believe monthly is pretty much the industry standard.
Our next question is, what organizations are working on changing the estate recovery laws?
I believe I read an article by Justice and Aging. It's a nationwide organization that focuses on equality and just better quality for our senior population. So I believe that they were focused on making improvements or getting rid of altogether that estate recovery law. Each state makes their own determination, but I think they were hoping to get rid of it altogether federally.
Chris is asking, have any of the estate recovery requirements / policies changed at all recently?
Not that I'm aware of, but there is an 800 number that you can always call directly to the estate recovery agency at the state and see what might be offered or adjusted. It really does seem to be a case-by-case basis, because I did at one point contact them for some details on what's included and what's not. And they don't really want to give you exact answers without a scenario. So,
Caitlin is asking, is the estate recovery for all residents or is it random?
It's not chosen at random. It doesn't necessarily affect all residents. To be honest, I think they focus more on the higher asset estates. If you're only leaving back a few $1,000s, I don't think they're too concerned about putting the effort into that one. I think it's more intended for someone who is leaving behind a home. And let's say a spouse lives in a home and the resident passes away at the nursing home. They don't seek to take that home until the living spouse would also pass away. And if there's a caregiver in the home, that is another potential exception that if you have, let's say, a daughter or son living and taking care of the other person in the home, that is a potential another exception.
Now, Jamie made a good point. She's saying, according to the PA elder law, estate claims need to be submitted to an executor within 45 days of receipt of the notice of the claim that, or it is forfeited. I can even speak of my own, experience with my brother. The lawyer asked you the first time you meet with them, if there's ever, if they ever that were on any type of assistance. And then I think they look into it anyway. So once they got the numbers, they have to do that, I think. Okay, so now I don't know if I missed a couple. The estate recovery, like you said, Cori, is really for the people that are on medical assistance.
Yes, it's only for people on medical assistance, because that's why they feel like, hey, we have claim to that, because you're leaving behind money. We spent money on you. Let's break even as much as we can. And that is controversial for sure, especially because even with the home and community-based services, I used to be a service coordinator with that aging waiver program, and I had a lot of people decline the program because they didn't want to surrender their home. They wanted their family member to receive that benefit once they passed away. So it's very unfortunate. It's keeping some of our consumers from getting those much needed services.
Carolyn made a statement that her mother died in November of 2021, and her only asset were 2 joint bank accounts with her. And she said, as a result, there was no probate. Estate recovery sent me a letter within 3 months confirming they would not be seeking estate recovery since the account was joint and there was no probate.
Oh, good. Well, that's a relief to know that was all cleared. And maybe your attorney will suggest that a joint account might be a good way to manage that.
Terry is wondering if a resident is allowed to maintain a funeral or / burial expense account, or does that count as an asset?
Typically what we see is residents creating an irrevocable burial trust, and then the state doesn't touch it. That's somewhere around $12,000 or $13,000, I think, you can put into that account. That does not count toward your assets, but that does have to be in, don't quote me on those numbers, but they seem to go up every so often. But that is a reasonable use of your funds to become eligible.
And Carolyn is saying, to clarify her message, her mother was on Medicaid and had, spent down, exhausted her assets.
Okay.
Jamie has a comment about cash values of funeral home accounts do count as an asset. So many folks convert those to irrevocable accounts, and it must be used for their burial account, their burial. And I believe it has to be something that's comparable to a funeral in the area. But like Cori said, there's a cutoff. And this person is wondering if irrevocable funeral account has to be set up before the person enters the nursing home.
It has to be set up in order to be eligible for Medicaid. So one thing I did forget to mention, Medicaid is retroactive up to 3 months back. So let's say Medicare cuts you off. Don't panic that you have to be applying for Medicaid that next day, because it takes a while to collect all those documents, but that's also why it's good to be prepared for that process, because even getting your life insurance policy statement can be a challenge, especially if you're in a nursing home. You don't have access to your bank accounts or your statements like you would if you were at home next to all your file cabinets. So those are things to definitely consider, but you can quickly transition those assets to the irrevocable trust. It's just you want to make sure you're on that so that you get that full retroactive window.
Carolyn is sharing with the group that Medicaid allowed her to cash in a $12,000 whole life policy that her mom had and set it up through irrevocable burial account through a funeral home.
Oh, good. Yeah. That's I think you're stuck in that position. That's what it's intended for. So hopefully that worked out okay. I think Caitlin had a question earlier about whether or not you should contact estate recovery or wait. That's definitely not a question I have a great answer to at this point, but it seems like estate recovery is contacting the families. So we can always give you those resources so that you have all that information and at least at your fingertips if needed.
Any last questions or comments for Cori?
Did Ken know whether or not, did he contact the medical assistance estate recovery people, or did they contact him? I don't know if Ken wants to comment on that. Yeah. Oh, okay. Carolyn contacted them directly. Okay.
Well, Cori, I definitely learned a lot again today. Every time you talk, I learned so many good things. You do such great research.
I hope I didn't miss too much.
I think you covered it. Thank you so much. Definitely appreciate it. Hopefully you guys got a lot of information from Cori's presentation as well. I believe she's going to send out a tip sheet for us that we'll share with everyone on our follow-up email. Hopefully tomorrow we'll get that out to you. Alrighty, thanks.
Ken just typed in there that the estate recovery organization contacted him. They initiated it.
So it seems like it can go either way, whatever your preference is. All right. Well, thank you, Cori. Fantastic job as always. All right. So our upcoming meeting topics. pretty much wide open at this point. We do have a lot of questions. Speakers we have been requesting, we just haven't confirmed anything yet. But we are reaching out to Veterans Affairs and a couple of different places that we thought would be pretty good presentations. Some folks we haven't had on before. So I'm also going to a conference with some fantastic speakers. So I'm going to see if I can get a couple of them to come on our meeting and share their greatness. So wish me luck. And as always, thanks everyone for attending. If you have any questions or comments, please let Jay know over at the State Ombudsman Office, 717-783-8975, or you can shoot him an email at ltc-ombudsman@pa.gov, or the Facebook page. We're in the chat area, or our YouTube channel now. So we're a little bit everywhere. So have a great evening, everyone.
Thank you very much.
Thank you.